I want to welcome everybody to today's podcast. My focus today is with Polly Heberly. I'm hoping I said that correctly. Is that right?
Yes, Heberly.
Good. Snohomish Acupuncture. And welcome, Polly. I hope you're ready to be grilled about everything you do. I hear you're quite extensive in your modalities. So that will be kind of fun to touch on a little bit of everything, or those things that hit your passion the most.
Right.
Does that sound good?
Yeah.
Okay,
I
so
can tell a little bit about myself if you want. I started off in the fitness like Megan. I was very much into fitness and teaching aqua classes and floor classes, and then I got into the yoga. And then from there, it all went crazy. And then I got into the massage. And then 10 years later, I graduated with the acupuncture and the Chinese medicine, which I was living in Hawaii at the time. So I got to go to this fabulous Taoist school in my backyard. Oh, excuse me. Should have turned that off. And I got a very awesome education because it was owned by Lily Sue Chong, who had come over from China revolution and joined together with Japanese Gail Tadoki. And so the Japanese, had taken the Chinese medicine and spun their version, which is more 5-element. Right. And so I got a really good foundation in not just the acupuncture, but the actual Chinese medicine, because it was a Taoist school and we were doing, all the Taoist things. Yeah.
Wow.
Going to China and it was very, I was very
phenomenal.
Lucky. Yeah.
Besides being set in a little bit of paradise.
Right.
I mean, what could be funner than hanging out and now when you are with a client, how do you determine the modality strictly by what they are looking for, or do you view them in a bigger holistic picture?
Yeah, the Chinese, they really take the person individually and, try to identify what the needs are by all these different diagnosing techniques that we use. And basing on the clients, what they have going on, this time of the year, people are stressed out. So I work with a lot of what we call the auricular acupuncture, which is in the ear mostly, all the ear points. And you can do the whole body through the ear. And it has an immediate response on the nervous system. I just came back from working with a longtime friend of mine who's been in a wheelchair for probably 15 years and some other complications. And of course, I can get through the whole body, right? Yeah, through the ear.
Now, from what I understand, is that not also true of the feet?
Yes, and the hands. The nerve endings, head, feet, and hands.
Wow.
And that's why we get the good response with the reflexology and acupuncture.
So with the times that we're in, which are, quite interesting, are you finding that people are coming to relieve or find relief for their anxiety, for the fears globally, or for the fear in their personal lives?
Yes, I've had a lot of people that this is an issue right now because things are so uncertain, and stress is such a health wrecker. It'll just destroy your health. It really will. And so for me, since I have the yoga and I have all these other modalities that I'm fortunate to have found this place that it's a center that people can show up. But right now we're just working individually with a person, but I try to get them to do some qigong as well, especially if there's, like for my friend, he's got use of the upper body, and so he can do a lot of upper body stuff to especially stimulate the breath, which is,
very important.
Yes. Yeah. Well, when you're afraid, you usually don't breathe. As you stop breathing, or the breath gets inhibited. And so that's something I've been working with for 20 years in my own practice is the pranayama. It's a breath that just translates to breath control.
So to touch a little bit on your space, you're local to Snohomish. Where is your space?
We're on Pine Avenue, 168 Pine Avenue, which is just side to the Everett Walk-In Clinic.
Oh, yes.
If you know where that is, just kitty corner from the Rite Aid store. We're just beside them.
Nice.
Yeah. Yeah.
That's lovely.
It's a lovely spot. It is. We're between two rivers, and in India, that's the most sacred space, in between two rivers. And it is a great energy there. I was very fortunate to find it.
So do you find with the moment we're in time with the COVID and all, that you're having to take in what you do, your modality and your practices with the social constraints? How does that work for you?
Well, I am very fortunate in the fact that I came into Kangen water within about the last year and a half. And that makes all these pH balanced waters. And one of them is they call it the it's very high acidic, right? We want to ingest the alkaline water, but the acidic water kills staph, MRSA, coronavirus on contact. So I have this, I don't have to rush out and buy hand sanitizers. I have clients that I use that because it's also a wound care water. We'll gargle it, we'll put it up the neti pot, and besides cleaning the office. And I've been into the Young Living essential oils for, oh gosh, over 20 years. And a lot of those are antiviral. And so we'll diffuse those into the air. But, we're working with the masks and the gloves and the shields and just doing the laundry. I have on-site laundry there, thank goodness. So everything just gets changed out after each. And we're keeping, I'm not even working with my insurance biller right now. She works when nobody else is in the office. So we're having less contact, right? Yeah.
Well, that's good for, for people to understand that your space and you are taking the utmost care to make sure that they feel safe and are safe when they come in. And that's excellent.
Well, you can't heal when you don't feel safe. If your nervous system is, in the fight or flight, you have two different nervous systems, the sympathetic and the parasympathetic, and one is fight or flight, and the other is rest and digest. And the only time we heal is when we're in the rest and digest.
Very good.
That is all part of it, and that's what I mean. Even Megan knows my old office, but I had this circular garden out there that was cut into like pizza pies. So I had like 8 sections. And so every client walked by that garden and they slowed way down as a feng shui thing, and they took that all in. And so it's a preparation even before you enter the door, is you're setting the nervous system. So every time they come back there, I had this one client, my good friend, her mom had some severe dementia, and she had some back pain, and she doesn't remember much besides just pulling up in front of my office and seeing that garden that she had been there before. So,
wow.
Yeah.
That's excellent.
Yeah.
So out of the modalities that you do, where do you find your highest calling? What's your passion level in one or the other, or do you just combine them? And
well, I guess I'm pretty eclectic now. Yeah, I am very eclectic now with the Chinese diagnoses. We read the eyes, we read the skin, we read the breath. But as an energy worker, you learn to read people's energy. So whether I'm seeing their aura or I'm following their charts a little bit more now, it's like, oh, so you're maybe a Gemini, and the sun's about to go into Gemini now, and Venus is in there, and Mercury just moved in there today, and how these can affect us. And it really does give a little bit of a spreadsheet or a list of like, well, maybe that's why I'm feeling this way, right?
Right.
Right now is a very interesting time because all these planets are turning retrograde.
Oh, wow.
Yeah.
That's big movement, or as in what people like to think, non-movement, but it's movement, right?
How about you? Are you following astrology yourself?
Ever so slightly. I'm just enough to be dangerous.
Yeah, right.
You know, it has always interested me, but it's not my calling to be a practitioner of, but it is fascinating.
Yes, I have a little more time on my hands lately, and this is the only person that I do the out call with is this wheelchair-bound friend of mine. But when I work with him, I do, because we do scalp as well, and you can get to different motor forms in the body. So I'll do a lot of stuff with him with the like we were talking about, the reflexology and getting to the nerve endings, right? Because basically it's a nerve injury, it's a spinal cord injury. And
so that's interesting, because I also have a friend who, I guess it's been about 7 years now, maybe not that long, who is from T6 down in a wheelchair and paralyzed. Mm-hmm. Well, she has
so he's got some movement. She has movement
but she doesn't have much core, because of, it starts right about at the diaphragm.
Yeah, that sounds like my friend, very similar. And so they have specific needs of always picking themselves up out of that chair. Yes. And so he gets very tight in the upper body. So with him, he can feel that upper body, and he needs that touch. He needs to feel that touch. So he's craving the massage and the reflexology. But what I really, because I always like to make, like I was saying, like they saw the garden on the way in, and it's kind of like I pass through this channel, then I pass through this channel, and I get it deeper, deeper, deeper into the onion. So with him, I start with aromatherapy always. Mm-hmm. And that, and the music too. I like to listen to a lot of Hawaiian music.
Oh, lovely.
It is nice. I don't get too many complaints. So, aloha.
So when you're working with someone and you're doing the acupuncture, if they have the desire to do it, maybe they're at the end of being able to find something that will help them, but they've chosen to give it a try, and they have a fear of, or the unknown of needle. How do you address that with?
I get that all the time, because I get parents that are bringing their children in. Right? So I work with little kids that, of course, don't want any needles, and older people that, of course, have fears and phobias, because every time we go to the doctor, they want to poke us or prod us or cut something off. And yeah, so it's a serious thing. And of course, with the massage is a very good way for them to feel comfortable in my energy and the way I work. And I also scope out everything on the body through these little intelligence seekers, not just, what goes in and out of the brain and things I've been taught and things I've learned, but, you start to work energetically with people. And so you just move, right? It's like, okay, something takes over, and it's guided. Yeah, it's very definitely guided.
So what do you say to young or children when they're in for a treatment and they like, I don't like needles?
I'm glad you asked me this question, because
so
the most important thing that I've found with working them, and this is just my experience, I'm not trained as a child psychiatrist or anything, obviously, but that they are heard, that I listen to them. So this one instance, I had this little boy, he's been coming in to me, I think he was 8 when he started, and we decided that he would have, I think it was maybe 3 needles to start with. And every time he came back, we'd add 1 more needle. And he's past this, he's changed so much. He had a lot of, some of these other children, some challenges with learning disorders or, even dietary things. But he's grown so much that he's leaped past that. He used to get terrible migraine headaches because, yeah. And so he knows that this helps so much. It's adorable. He just tells me, Polly, just do whatever you want to do now. And but we do have certain things. He likes to be able to see the clock, you know. And but it's a rhythm that he comes in, this happens, and with children, their energies move so faster than us at this old age. They're very vital, what we call the chi, and maybe you've heard of that word, the chi, right? The vital energy in the body. And so they process very fast, and it takes less time, less needles, and it's quite amazing.
They are
so
quite amazing, right?
And
so when they came in, let's use him as an example. When he came in, your empowerment of giving him choice was that was a big factor to move
That's
forward.
Huge. Yes, that I heard him, and he said, sometimes he tells me none in the head, and I don't put any in the head. Right? He's in control. And I think that's really important for them, is they need to feel just like we need to feel when we go into somebody's office. They want to do some procedure to us that sounds, mortifying. We're going to say, I think I'm going to pass on that.
Right.
And to be allowed that, to make the decisions for themselves, which I don't know what generation you were raised in, but probably close to mine, is that our parents didn't allow us to make the decisions for ourselves like a lot of the parents are doing now with learning, how to raise children a little more user-friendly.
So with the children, what is if someone were to call for an appointment, what's the youngest do you have a cutoff on youngest?
No. Oh. I have grandchildren now. And my daughter-in-law was just recently pregnant with baby number 2. And so she would come in, and it was the same thing. It was the same thing. He knew he was going to come here and he was going to have fun, and then they were going to be done. And he helps me take the needles out even. He's very this, but I used to sneak a needle just on the top because he would get that teething, runny nose. And he didn't even know it was in there because we have some very, very fine. They're so tiny. And we always joke that he always feels better when he leaves. He doesn't know why, but he always feels better when he leaves.
That's excellent.
Yeah. And when I work with parents, I say, now watch your reactions, because they're going to listen to the sound of your breath. If you're going, they're not going to want that. They're not going to want to accept this treatment for themselves.
Right.
But I did work with one of my daughter's good friends. She is very much, she's a nurse now, but she had this other child that had some asthma, and he had been in the hospital with bronchial pneumonia, and I think he was only about 9 months old. And she called me on the phone and said, what do you think? And I said, well, let's try it. Because this is a girl, she has children of her own, and it wasn't even her child. And it was her friend's child that she was watching. This baby was the breathing, how they get really, really raspy. Yeah. You could hear the mucus in their chest. And he had been in the car. They were driving from Bellevue. And so he was very relaxed in the car seat and asleep in the car. And so he was pretty asleep when he got there. And I said, now just put him on your chest as you lay on the table, and I'll do whatever points I can. So his back was exposed to me, and I got to do all those lung points over the back. And she said she could just feel his breathing changing, because he was just laying right on her. So yeah, it depends on the situation and the people that are working with the child, of course. But I don't think there's anything, and that's the Chinese. They really believe that the sooner the better.
Yes.
The sooner you plug into this, the better, and that you can have a quality of health at any age. Yeah.
So how do you promote that in in the community? How does that? What does your? I'm assuming you have a website.
I do. I don't promote much of this on my website, though. But I think it's that story about if you fix somebody's sciatica in one treatment and they're no longer in pain or something like that, they're going to tell at least their close surrounding people. And so it just spreads that way. It does. That's what I mean, is this gal that brought me the little baby. She was a client that I had treated for a long time, knew her growing up because she's my daughter's friend. And she knew I could do things.
Nice.
And she asked me if I'd try, and we played it by ear. You know, if the baby would have woke up and started crying and not accepting any of this, it wouldn't have gone down that way. But with her energy and his energy, and it's a group effort. I have never needled my oldest grandchildren, but they watch their parents receive. And that's what I mean. I tell the parents now, if you want them to receive this treatment, watch your response around them, because they are watching.
Oh.
Like I said, my youngest grandson wants to help me take out the needles. And I let him, because I want him to know that this is not that foreign. Like for me, I learned the Chinese way, what they used to call it was traditional, but this is really more than that, because I learned from a Chinese master, and she didn't translate this to English for me. So I learned it all through the Chinese. It was a very foreign.
Wow.
Right? All the language and everything. And so that's the thing, is I try to let people realize that this is all understandable. Right? Yeah. I'm not saying anything that's just like totally out there. It's energy, and what happens is, well, you get blockages, right?
Right.
Whether it's a migraine or whatever it is, sciatica, it could be anything, right? And so I have people ask me all the time, let me just finish this real quick.
Oh, sorry.
Is it good for this? Is it good for that? Is it good for this? And the answer to all of that is yes, it's good for everything. Whether it's emotional, I work with a lot of post-traumatic stress disorder. It's good for addiction. I used to volunteer 3 times a week in a clinic, and then that's where we did a lot of the auricular stuff. But yes, it's good for everything.
So let's touch a little bit on, because of a couple of the terminology, a couple of the things that have been spoken, as in the points that you put the needles in. Tell people what that is, what that looks like, if they've never had acupuncture.
Well, you know, that's the big joke. Maybe you've seen that cartoon where the cavemen are chasing the mammoth with their spears, and they poke him, and he says, "Oh, I don't have any neck pain now," you know, and they're poking him in the wherever, right? So it is what we call meridians, these energy channels, and they'll follow things like the nerves and the veins and the arteries, but they have their own unique pathways through. Yeah. And so if you know where the blockage is,
yeah, that's where I'm going.
All through the pulses. For me, that's one thing that's coming up really, that's been big in my practice ever since I got out of school, because I was learning so much in school that the continuing education after I was out of school, I had more time to really go into the pulses. And that is something that you just learn over time and experience with everybody's pulses, like especially pregnant women, because that's an excess, right? And mostly of water. So it's an excess of dampness, and it's really easy to tell it in the pulses. I mean, you get these Chinese masters, and they take your pulse and they say, you got to go to the doctor right now.
Right.
And yeah, it can save your life.
So with the different elements that you obviously pull in via your knowledge, the heat or the dampness in a body.
The 5 elements, right?
Right.
I'll get to you real quick. The water makes the wood. The wood makes the fire. The fire makes the earth like a volcano. The earth makes what the minerals that we call the metal element, and the metals make the water, and the water makes the wood. And then you have all these controlling things, like the water controls the fire. The earth controls the water. I mean, it's just, it's beautiful, right?
So
it makes sense. You can explain it to anybody.
When you have someone come in and you touch, feel, intuit, you know whether you're going to be working with what element or how to work with the element?
Yes, that's the first thing we do. And even the gal that does, Shannon, that does my insurance billings, she knows, because I chart my their color of their chart by their element, right? Because the fire is the red, the blue is the water, yeah. And so that's always her big thing, is she's trying to guess their elements, because she's learned so much by being in this practice that she could pretty much guess the elements too. So the first thing, I start off, what element are they? And then I know what if you're a wood element, say you're a tree, which is the time of the springtime, which we're in right now, when the wood quickens and the springtime comes up, what damages the trees? The wind, sometimes the fire, right? Or drought.
Right.
So you take all these things into consideration, because with Chinese medicine, we don't just say, "Oh, you have a broken arm here. Oh my God." We say, "Okay, the bones are ruled by the kidneys. That's, the big chi, because what lasts after the body is dead is the hair and the bones and the teeth, and that's all parts of the kidney foundation." So yeah, it's
Fascinating.
interesting. Very interesting.
So let's shift gears just a little bit and tell me more about your massage practice, the end of that you do.
Yeah, I graduated in Lake Stevens from Spectrum School of Massage in 2000. So that was 20 years ago. And
Wow.
I got an excellent education. It's a very, very small school. If anybody's thinking about going to massage school, I want them to go there, because it was amazing. And I was living in Hawaii. I had just been back on the mainland for finishing my schooling in the massage, and then even though I got my Washington license, then I'd never used it because I was in Hawaii. And in Hawaii, lomi lomi just means massage. And so everybody in Hawaii learns massage. And this is one thing that is proven fact, that if you massage your children, they're much more likely to massage you in your older age. And children really respond to
well, that's a sweet thought.
So well. Yeah. Let me tell you a story about Megan, who you know, and her youngest son. She was coming to me for, I think it was some carpal tunnel issue or something like that. And he knew it. He knew that she was spending money for this treatment and getting massage. And he said, "Well, I want this." And she said, "Well, I'm not just going to give you the money for this." He said, "I'll earn it, Mom. I'll massage your feet. I'll do your feet 5 minutes every night for," I don't remember what the dollar amount that it was, but it added up pretty good for, 5 minutes for a dollar amount for hourly. But the last session that she had bought a package of 3 with me, and she asked me, "Can he come and watch?" And I said, yes. I don't remember. I think he was preteen at the time. And it was really fascinating. He paid attention to everything I do. So everybody can do it, right? And it's such a connection. I don't know if you have little kids, but my grandchild was just born premature. And I just held her for the first time on Saturday, 5 pounds, 6 ounces at the time. And so I did a lot of reflexology with her on her feet and her hands and her head.
Oh, yeah.
Yeah. So starting that off already.
She's going to love that as she grows up.
Yeah, we all do.
That's
and like I said, like my friend in the wheelchair, he needs that touch. He can feel that touch. He can't feel it through the rest of the body. So it's a huge message when a lot of our language is nonverbal. Right. And it's not, sometimes we do communicate with the touch.
So as you go through all your modalities, where are you headed? How do you want to?
I want structural alignment in the body. I've been into the yoga for over 20 years, before the massage even. So the body loves alignment. It can operate much more functionally when it has proper alignment. So and also the breathing, as we talked about a little bit before, especially now people are, maybe if you're, let's say you're depressed, what's your body language look like? Your shoulders come in and you're trying to protect your heart all the time. Yeah. And so we're just closed in on our hearts. And so that's been a lot with my yoga practice. I'll tell a little bit about it. Is about 7 years ago now, I said, I'm going to dedicate this year to heart openers. And so I did a lot of back bends and, bridge pose, and I'm opening up my heart. And that wasn't a year-long practice. That has been a constant practice now that hasn't gone away. And the message has come through. It's evolved to not just open your heart, but to relax your heart. And how does one do that? Yeah, I could ask you that question. Yeah, what would you do if you wanted to relax your heart? Now, Mother's Day was just the other day, right? And
oddly enough for me, I forgot that it was. It just doesn't hold. A lot of people have a good deal of emotion around it. to me, I'm more of every day is an important, every day is the way you should treat the people around you. It's not just a day. So that's kind of my gig,
I guess where I'm going with this is love. Because where do we first receive love? Where do we first experience love is usually our mothers.
Yeah.
Right? Or the father figure, or the grandparents, or the siblings.
Yeah.
And when you start to work with the heart, especially, I'll tell you a little bit of a story. I had this client in Hawaii, and she really got me into all of this astrology, and I was only doing massage at the time and hadn't even been into the acupuncture yet. And she wanted me to work with her mother, who was having some heart issues, and I said, okay, I would love to work with Pearl Lee. Was her name, Pearl Lee.
Oh, that's a beautiful name.
I know. Her last name, Lee. God bless her, rest in peace. She had to have open heart surgery. And my friend, her daughter, was caring for her mother. And so she got to experience a lot of what her mother went through when they opened up her heart. After they put her back together and she was healing and she would share these things with us, she said, Polly, I'm having all these dreams. I'm having all these vivid dreams of way, way back. Way, way back.
Oh.
And it's like opening up a can of worms, because Chinese medicine, the heart stores the long-term memory. So this is why people with dementia, they can remember way, way back, even though they can't remember what they had for lunch. But that's another thing I would like to touch base on just briefly is I've also been doing intermittent fasting for over 2 years, which totally can reverse the signs of dementia, because what happens when you do intermittent fasting, the liver, which is the only organ in the body that can rejuvenate itself, and it takes about 500 days to fully do, is it stores the blood sugar. It rules the blood sugar. It stores the glucogen besides purifying and storing the blood. So it determines where your blood sugars are at. So when you do this fasting, you deplete the store of glucogen, the sugars out of the liver. And when you do that, the kidneys, right, the big power, starts kicking out the ketones. And the kidney pairs yin to yin. Maybe you've heard this yin-yang thing too, right? That could go on and on about that forever. But just basically the kidneys pair with the heart, and that's the Xiaoyun connection. When I was in school, Sir Fu would say, people we didn't even know, their Xiaoyun's not integrating. The Xiaoyun's not integrating, and that's a death sentence, pretty much. And let's see, where was I going with all of this? I've kind of lost my train of thought, all this yin yang and everything. But
with the intermittent fasting and Pearl.
Yeah, the intermittent fasting and everything it's so. What's killing Americans? Heart disease, diabetes, besides the cancer, right? So intermittent fasting gets rid of all autoimmune disorders. Take that in for a second. That's diabetes. That's and rheumatoid arthritis. That's all the arthritises and everything, even some asthma stuff. And I get a lot of people with this sentence that the doctor has diagnosed them with autoimmune disorders. Where do you go?
Are you integrating that into all these practices? How do you bring that to someone who has been diagnosed with diabetes and they come to you? So do you bring that into their awareness by speaking about intermittent fasting?
I do, and I think intermittent fasting is such an easy thing to do. Okay, I'll tell you, this one lady, she was a retired nurse. She was probably about 80, and she was coming to me for pain down the left arm, which is heart attack symptoms, right?
Yep.
We all know that. And she was in her 80s, and I told her about it, and she said, well, Polly, I don't know if I can do, because we like to do a 16-hour window when we're not eating, but she said I committed to a 13-hour window. She came into my office about a week later, because it starts very fast. Once you do this fasting, it starts fast. She's 84. She lifts up her shirt in my waiting room and shows me, look at my belly's going down, and I can see it because the weight comes off right around the lymphatic system so much that, when you can clear out your lymphatic system, that is your immune system, right? Because, Yeah, lymphatic system picks up 40% of, that the rest of the body doesn't throw out. Yeah.
So it sounds like you are kind of bringing in it's not new because it's been around for a while, but for a lot of people, the understanding how their body works in all these modalities.
Yeah. Well, for instance, I get somebody that comes in that's not breathing, not taking a full breath. They're up here. Their nervous system is frayed.
Yeah.
And when you get like that, if you've ever talked to people that have been on anti-anxiety medicines or antidepressant medicines, they say, I didn't know how to get off of that. They say, pick yourself up by your bootstraps. Well, I didn't know where my bootstraps were. I had no idea how to do this. And so that's why you come to somebody, a therapist, hopefully, or it can even be a friend that says, well, why don't you just exhale completely, And so just do that. Because I'll explain one more thing, is that the lungs are only responsible for the exhale. Kidneys grasp the chi on the inhale. So you can't fill up what's already full. And when you're full up here, the kidneys are struggling, and that's your power, right? That's your real power. And what damages the kidneys is fear.
Yes.
So, especially now, we got a lot of that.
Well, there is. And I would love that we have another conversation, but I feel like timing wise, let's kind of talk about people that you know within the community that you might send someone to if you don't do a particular. Do you have a network that you also use within?
Not so much, because of a lot of my education was in Hawaii. I didn't go have these, like when I'm in Hawaii, I have all these classmates and, they're doing all these things. But there was one gentleman, and he was a chiropractor that became my client in a different life. He had stopped doing that and became a peace officer, actually. What a switch, right? In careers. And he would get up off the table. He loved the acupuncture. He would just zone out, and he would tell me, I swear he was an ascended master, but he would ask me once in a while, can I adjust you, after he got up off the treatment? And I, of course, said yes. And he did a neuromuscular skeletal stuff. I don't even know if I'm saying that right, but it's kind of like he'll tap me here, tap my feet, tap my here. And that's it. Because I don't know if you with chiropractic, and I'm not trying to give chiropractic a bad name. It has a lot, I still talk about the structural alignment of the body, and that's what they do. But this is more with the nervous system.
Right.
And so what did you do when you dissolved your practice? He said, I sent them to Kirk Edmark, 3 first names, Kirk Edmark. And he is over by Tom Thumb. And for instance, I work with massage therapists. I do have massage therapist friends. Shannon, she just got married. It used to be Crossman, so now I can't remember her last name right now, but you can definitely find her with Lakeside Massage in Lake Stevens. She sent me a client that had been in a car accident. She said, I think they need, because I was working on her husband, that I think she needs more than this massage, Polly. She's only coming this far with it. So she sent this gal to me, and she got great results with the acupuncture, but I said the same thing. I think you need chiropractic. There was so many things that were going on with the nervous system, the spinal cord, right? That structural alignment in the spine, that I sent her to Kirk Edmark, who I've never even had treatment from, but I knew he did this kind of neural thing. She came back to me and gave me a little feedback. She said, well, it was the weirdest thing, Polly. He had me on the table, and she said, he did a little this, that. And he told me, now, be careful when you first stand up, you're going to feel dizzy. And she goes, I did. I stood up, and I was a little dizzy. But then it went away. It dissipated. And, it's amazing work. So I totally recommend Shannon. She is also a yoga instructor, very into the yoga, very into a lot of modalities with the cupping, which we're all getting into, the massage. We love that. And I think she does some foot massage where she's standing on you, you know, where she's standing on top of the table. And I think she does the hot bamboos and the hot stones, which we all love as well. And I do as too. I do. We do the cupping and the hot stones and all that too.
Good. I think we have to wrap up. We're down to the wire. It has been delightful talking to you and hearing all about what you do. And I hope I have another opportunity to delve a little deeper. It has
And I'd love to hear more about how you work too as well.
Well, that's a whole nother conversation. That's great. That's great. So to the listeners, I'm Catherine Andrews with Healing Through Awareness, and this has been Polly Heberly with Snohomish Acupuncture. I hope you've enjoyed yourselves and come back and join us. Thanks, Polly.